I'm going to ask, what is this, teacher? A bit in a practical sense. In preselection, there is firmness. It reaches the very entrance of the vagina, and that's it. This is classic mitotic. Erection also happens with masturbation. So there is an erection with masturbation, it ejaculates, and there's no problem. There is firmness until the end, but what happens when it reaches the entrance of the vagina? What's underlying this? When it reaches the entrance of the vagina, the man's mind goes down. So the concept of the penis going down, the mind, it starts to stop working, because at that moment, intense anxiety rises within him. At any moment, something will happen, and I won't be able to do it, I'll lose my erection, so the man is constantly in a state of accounting. Right at that moment, just when about to have sex, everything ends. What the man is experiencing in his mind at that moment is performance anxiety. So, is it just about performance? So, could there be fear or something? Don't be afraid of the base. We're talking about the same thing. We can also label it as fear. There could be a disgust disorder, for example, regarding sexual intercourse, regarding the base. Sexual intercourse itself creates a number of psychological effects in the man's inner world. It can stimulate points. So what can we do? What's happening? For example, what happens when a patient like this comes in? What do you do when a patient like this comes in? Doctor, mine is going down right at the base. So, when a patient like this comes to me, you're saying it directs you. There's nothing to be done about this because there can't be any physiological or organic issue. Sam had mentioned this about the goat, and it really stuck in my mind in education. There are two bicycles. You can ride one, but you can't ride the other. So it's not the fault of the bicycles. This image is not ordinary. So it's the same bicycle or the same car, but I can ride one. I can't ride one. Very nice. I liked it. So for example, you have sessions with them. So what needs to be revealed is why they feel that anxiety. So what are you trying to uncover? What about it? First of all, the man needs to understand his current situation. He can't make sense of this. Man, I'm healthy and fine in every way. I'm comfortable during the foreplay. What happens to me just when I'm about to have sexual intercourse? What do I have? He can't make sense of this. First of all, he needs to make sense of the situation he's experiencing. We need to explain it. He needs to be aware of what the existing fears, anxieties, the performance-related unease and fears of inadequacy are. He needs to accept that there is such a problem. He needs to understand this. There's nothing... He needs to accept it. He needs to accept it. After accepting this, what should we do now? The answer to the question varies for each man during the therapy process, but we establish a process. Do you do hypnosis? We do hypnosis as well, of course. Will he go to hypnosis if it doesn't get resolved? No, it's not that he goes to hypnosis if it doesn't get resolved. Sometimes we can reduce his anxieties just with hypnosis. Sometimes we can also use hypnosis as a helpful technique. We also use it. We can reduce anxieties. So, is it possible to find something he experienced in childhood through hypnosis? It is definitely possible. By regressing, with hypnosis, we can address a trauma we experienced in the past. A problem we experienced in the past, like a school failure, is more important for women, for example, for the vagina. So some women are abused in childhood. What can he remember at 3 years old, 4 years old? For example, can you find that through hypnosis? Absolutely. At 4 years old? Even at 1 year old? At 1 year old? Of course, definitely. Kamil, can you hear me? Hypnosis at 1 year old. So, that's interesting. Yes. Having hardness during masturbation but not in a relationship is the same as when the penis goes flaccid in vagina. Same thing. Same thing. So, it's more accurate to make comments from man to man, from person to person, but we are mentioning some general topics. Losing an erection while inside the vagina or losing it before entering. Of course, if there's nothing physiological, there's nothing physiological. If there's no vascular issue, if there's nothing hormonal, yes, of course.